and the Associate Clinical Coordinator, Mr. Jerry Erickson. I've known Jerry, go ahead. I've known Jerry for quite a while now, and I can tell you a lot about him. I can tell you he's been a PA since he graduated from the Emory PA program in 2003. I can also tell you that before becoming a PA, Jerry had a few jobs in medicine. He worked as an EMT, he worked as an ER tech, he worked as a phlebotomist. He even thought about going to vet school before he found out he was allergic to cats, which I was But most notably, he began his medical career by serving the U.S. Army as a combat field specialist, medical specialist. I can tell you that he's practiced in rural health care in a federally qualified health center. I can tell you that he's an ambassador for the National Health Service Corps. I can tell you that he's an active member of both our national and state PA organizations and serves as an active member of the Board of Directors for the Fellowship of Christian Physician Assistants. I can tell you that his beautiful wife is here with him tonight, and two beautiful children that are mirror images of their parents. I can tell you that he's passionate about health care, about students. He likes to do a job well done. I could also tell you that he's been a long friend of our program, having been both a guest lecturer and a preceptor before joining us as a faculty, but he could probably tell you a lot more about himself, and I'm going to let him do so. Welcome, Jerry.
Thank you, and welcome again to the 2012 Mercer University College of Pharmacy and Health Sciences Physician Assistant Preceptor Recognition Dinner. Long words, but thank you for all you've done here. And as being a clinical preceptor for years, and now on the side of academia, I can tell you that as preceptors, what you do is invaluable. I know that firsthand from being a student and now as a preceptor previously and now in academia. It's totally invaluable to the complete education of a physician assistant student. And I look forward to meeting all the preceptors out there and fostering a relationship to enhance and strengthen the clinical rotations that the students have, and for the experience for you guys as well. So I really look forward to that. But, okay, so now that the formality's over, let's have a little fun. And thank you, Amy, for that wonderful introduction. So, who here, by raise of hand, is a Southerner? True Southerner. And I mean that you were bred, born, and raised in the South. Okay. So, I'm going to go over a little topic. It's not really a teaching topic, but I'm going to go over a little topic about Southern medical terms. And I'm not talking about the Southern medical terms that you see on the internet, like, Jeff Foxworthy stuff. Some things are funny, like, dilate, which means to live long, or cauterize, which means to catch your eyes, not make eye contact, or something funny like bacteria, which is the back door of the cafeteria. That's just fun. That's not true medical terms. I want to talk to you specifically, and I have props here, so I'm going to change here, about true medical Southern terms, and this is stuff that I've heard over the years, and that my colleagues have heard, and even my wife, who works in the emergency room as a nurse. So I'm going to do a little skit, so to speak, and there's three patient skit, and I'm going to act out, because living in the South most of my life, I can speak Southern. So I'm going to act like I'm the provider and the patient at the same time, kind of like the Victoria type thing. Bear with me. Scenario one. I'm going to have to go back to here, okay? All right. Hey, you got to get ready. Hi, my name is Jerry. I'm the PA here, and I'm going to be taking care of you. What can we help you with today? Well, yes, I got the sugar, I got the high blood, the low blood, and I need my prescriptions. Okay, so let me understand this. You have diabetes, hypertension, and anemia, and you need to refill your prescriptions? Well, yes, that's what I said. And you know what else? I got fire in my stomach, and it's boiling over. And the doctor before said I got the helicopter pilots in my stomach. Were you treated for this before? Well, yeah, they used some antibiotics, and they gave me some of that purple pill, and I need one of them too. Oh, okay, so you had an ulcer, and they said you had Helicobacter pylorus. You were given antibiotics, and then you had some next thing, you need a refill of that. Is that right? Well, yes, sure, that's right. And I also got I got the fireballs in my uterus, and it's real painful. And I need a pain pill. I think it's called Loritab. Is that what it is? Yeah. So you have fibroids in your uterus. And you need Loritab. Is that correct? Why, yes. All right. Patient number 2. Hello, my name is Jerry. I'm the physician assistant. I'm going to be seeing you today. So what can I help you with?
Well, let me tell you something there, boy. I had a problem. I had a spider bite, and it's down here on my leg, and first it was a pone, and I think I was messing with it too much, and it got all red and swollen, and now it's arising, and it's seeping infection.
A pone? What is a pone?
You ain't from around here, are you? Ain't you ever eaten cornbread pone, little corn pone? That's what it looked like at first. It got all red, and now it's oozing that infection.
Oh, okay. So you had a little skin infection and you messed with it, and now it's an abscess, it's draining.
Now you're right, city boy.
Patient number 3, and this is the best one, it's my favorite. And by the way, everything I've said is an actual true story, and some things maybe taken a little out of context, but everything I've said. All right. Last patient, this is my favorite, because it's really true. All right. Hi, sir. I see you're here in the emergency room. My name is Jerry. I'm going to be taking care of you today while you're here. So, what brought you in?
Well, I done fell out and had to take an ambulance and here.
Yes, sir. You were found unresponsive. You had a sinkhole episode, and EMS brought you in here. Has this happened for you before?
Yeah, that's right. I got the fits, and I think I had a grandma and grandpa seizure. And I got to take the peanut butter balls.
Oh, I got it. You have epilepsy, and you had a grandma seizure, and you take phenobarbital.
And that's what I said. And not scared there was going to happen what happened before.
Well, what was that? What happened?
Well, I had a bad sinus infection, and there's a bone making up the phlegm. It's all yellow and green. And then I got a bad headache and a fever, and my neck ached, and I went to the ER, and the doc said I had the smiling might of Jesus.
Smiling mighty Jesus? Is that what you said?
Yeah, that's right. They said I had an infection in my head and my neck, and they had to stick a big old needle down here to figure it out.
Oh, you had spinal meningitis.
That's right.
So that's just a kind of couple things. And realize that, if you guys have some true medical Southern terms that you've heard that I haven't said, please let me know, because I want to compile these and move them on, because it's really funny. I'm really, really happy to be a part of this team, and it's something I've always loved to teach. I taught as an undergrad. Actually, before that, I taught in the Army, and then I taught as an undergrad, and then as a graduate student, and then and since I've been a PA, and I actually did an academic medicine fellowship, and I just totally fell in love with it, and I think I found the right place, and I thank you for welcoming me.